Hello folks, and welcome back to another fun episode of Insight of the Week, and this time we're back to our exercise of the week. So today I want to talk to you about feet and ankles. I've been thinking about this a lot lately. I think this is a great lesson for a lot of folks. Here's the deal. A lot of people come up to us and they say, I have just tight calves, naturally just tight calves, that's why my ability to bring my toes towards my head is really not very good. It's because I have tight calves. Well, sometimes that is the case, and we need to loosen things up in the calf. But a lot of the time, the problem isn't necessarily that. And when people are coming in and we see this, sometimes we're not actually looking at their ankle specifically for pathology, because their ankle isn't what hurts. It's something like their hip hurts, or their back hurts, their low back hurts. So this is going to apply to a lot of different folks. And the reason this is a problem is because when I have them step over their foot, or if I have them bring their toes up towards their head, the problem, they feel some tightness in the calf, but oftentimes they'll feel a little pinch in the front of their ankle. When that's the case, oftentimes I find the problem isn't really with the calf, it's with the ankle joint itself and what it is and is not doing. And this is where we get into technical things with arthrokinematics and the foot, knee, and ankle relationships. But I'm going to try and simplify it down today for a quick little exercise. So if you're feeling like you can't bring that ankle up, or you try and squat down, you feel that pinch in the front of that ankle, this is an exercise for you. And what I want you to start thinking about is something that used to be a really bad word in the world of fitness and physical therapy, and that's pronation of the foot. So pronation, the foot is not a simple hinge joint. The ankle is not a simple hinge joint. The foot kind of moves around in a rotational manner, and that involves the foot and the tibia. And that, of course, goes all the way up the chain into the hip and low back. Again, simplifying this to just this part of the joint for now. What you're going to start to do is something that will help you pronate the foot. Because when you naturally step, you are supposed to get a little bit of pronation there. It's actually an important part of the motion of the ankle. So, in order to accomplish that, what I'll have people do, and sometimes you have to take the shoe off to do this, is I'll just get you into a simple, basic, mini lunge position. You don't have to go deep into lunge. And all I need you to do is bring your knee towards the front of your foot, over the toes. Now, certain important things here. I don't want the hip rotating in or out. I want it nice and straight, and the knee goes nice and straight towards the second toe, not the big toe, but the one next to the big toe. Your knee stays in that line. And as you do that, what you're going to feel is, if you feel that pinch, I want you to focus on the ball of the foot pushing down into the floor as you go forward, okay? And that might alleviate that pinch and allow your ankle to move better, and might loosen up those calves too. That's our insight and exercise of the week. If you have any questions on that, or you're having bigger issues with your ankles or hips, come see us here at Insight Rehab. We'd love to help you out. That's our Insight of the Week.